Hi, my name is Sarah Messick, and the population that I chose to discuss are individuals who misuse, abuse, or are addicted to illicit narcotics or opiates. And this PowerPoint will be going over the health concerns related to that. So, individuals who misuse, abuse, or are addicted to narcotics or opiates are at an increased risk for multiple health disparities. This can be due to access and quality of healthcare, their environmental and social factors or stresses, and their social status. And some individuals are even born with an increased risk for drug addiction due to genetic ties or their environmental and social factors that they grew up with. For the size of the population, it was pretty hard to find local and statewide specific statistics on this. So I wasn't able to find super specific information, but overall, what I was able to find out was that the larger the population, the higher the number of individuals that there are misusing and abusing drugs, opiates and narcotics. And I think that's just because there's just more people. So internationally, in 2019, 275 million people used drugs at least once. 62 million of those people used opiates, and 36.3 million of those people suffered from drug use disorders. It is estimated that roughly 2 million people in the United States do have a substance use disorder related to opiate use. And from 2010 to 2016, opiate overdose deaths have actually doubled. Nearly 1 in 3 Americans know someone who is addicted to opiates, and 1 in 10 say that they themselves have taken an opiate without a prescription. Each week in Utah, roughly 10 adults die from drug overdose, and 8 of those deaths are the results of opioids. And then I was able to find out that additionally, those are actually, a lot of those deaths are due to prescription opioids, so they're not even really like illegally getting them off the street. And then locally, in 2019, Weber County had 59 deaths related to opiate use. And then I was also able to find out that Salt Lake County also has a high rate of opiate deaths, and I think that's due to the size of the county as well, because it's pretty large. So, contributing factors for social determinants of health, I think that economic stability is a potential barrier for individuals struggling with opiate and narcotic abuse or misuse or addiction, because they often have trouble finding or keeping a job, which leaves them living in poverty because their money goes towards buying drugs and leaving little to no money for clothes, shelter, healthy food, education for themselves or their children, or healthcare, and this makes them unable to provide support for their family or their individual needs. Specific concerns for this population, so they're definitely at risk for multiple concerns, economically, physically, and psychosocial concerns. So many people addicted to drugs are also diagnosed with mental health disorders, and I think that this could go either way. I think that they could either have the mental health disorder first and then use drugs as a way to cope, or use drugs and kind of develop the mental health disorder. So when compared to the general population, individuals addicted to drugs are twice as likely to suffer from mood and anxiety disorders. And then also, this drug use and misuse and addiction disrupts close personal relationships, causing emotional damage. They're often financially unstable, which adds stress, and people with addiction often have other associated health issues, including lung diseases, heart diseases, possible strokes, infectious diseases, and even cancer. So the root cause that I narrowed it down to was low socioeconomic status. This leads to additional environmental and social factors. So this could say, like, you could say that they may not have adequate access to healthcare, finances, food, clothing, or shelter, all leading to additional health disparities. For the Maslow hierarchy of needs, I think that this really depends on the person's specific situation. I think that some people can keep their opiate and narcotic abuse, misuse, or addiction going on for longer than others and can be more stable with it than other people can. But overall, I would say that baseline, their physiological needs are met. Sometimes this isn't the case, but I'd say overall that they are. They can go to homeless shelters and get help that way. But unmet would definitely be safety, because I don't feel like they feel secure in those places. They're usually not employed, or they have issues with employment. They could have issues with their family and with their health, love and belonging. They might not really feel loved or that they belong because of those relationships that could be, in a sense, ruined. Also, I don't think that they have the highest self-esteem or confidence, and they might not feel like they're respected. And then they definitely need to meet all of those before they have self-actualization. So overall, individuals who are currently abusing, misusing, or addicted to these opiates or illicit narcotics are not highly functional, just because their physiological needs may be met, but they do not have many of their needs met because they're usually very unhappy with themselves and their situation is probably not adequate. They rarely keep close relationships that were once important to them, and they have a hard time holding down a job. So overall, their health outcomes are likely poor. They are at a huge risk for overdose and other complications related to using long-term narcotics. So this population is at an increased risk for communicable diseases. Two common ones are HIV and Hep C. These are both spread through injection of drugs. So 1 in 10 cases of HIV accounts for injection of drugs, and then another form, so Hep C is also a major factor when it comes to spreading with the injection of drugs. And then intoxication makes individuals more likely to participate in risky behavior. So this could be sex without adequate protection, leading to an increased risk for STIs or STDs. So individuals can stop the acquisition or decrease the transmission of these by participating in safe sex practices, refraining from sharing needles, maintain adequate health hygiene standards, and if they do get any medications for tuberculosis, that is more common in homeless shelters or homeless camps. So if they do get that, make sure they're doing their follow-up appointments and taking the required medications appropriately. Non-communicable diseases, so we already talked about this. There are at risk for heart disease, lung disease, stroke, and even cancer. So they should be seen by their primary care physicians. If they can, stop taking opiates and narcotics, get the help that they need. If they need to take any medications, take them appropriately and try to make healthy lifestyle choices. They are at risk for self-care deficits and self-harm. So individuals within this population often suffer from mental health disorders. This could put them at risk for suicidal ideation, depressive thoughts, and severe anxiety. Also, if they're having severe withdrawal or intoxication, this could lead to self-care deficits, including inadequate oral intake, inadequate hygiene, inadequate health maintenance. Individuals within this population who are homeless might experience self-care deficits because they just don't have access to what they need from harsh weather conditions. They might not have good clothing. So they should seek help from community resources, and if they're having any self-harm thoughts, they can always go to the nearest hospital or call a suicide hotline. Risk for harm by others or to others. So I do think that they have the potential to do both. If they're trying to get drugs, they could harm other people. They could steal, they might threaten. They also could be harmed by other people if they owe somebody money or somebody else is trying to steal something from them. It could go either way. So individuals within this population should not participate in illegal activities and should always reach out for help when they feel like they are in an unsafe situation. And this is my reference page. Okay, thank you so much.